Greetings to all Physio TV viewers. Welcome to Little Masters series. I am Maria Saeed, Community PT resident at Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy. So today's topic is worker care spectrum. So worker care spectrum, ability management, job analysis. So the objectives of today's talk are by the end of the talk, the audience will be able to understand worker care spectrum, ability management, job demand analysis, task analysis, and ergonomic evaluation. So what is industrial therapy? Industrial therapy is a system which encompasses a wide spectrum of treatment based upon the principle that a person working in industry, as anywhere else, has physical, emotional, vocational, educational, psychological, and sociological needs which must be met to gain successful employment, or in the case of injury, rehabilitated and re-employed. So earlier we used to only follow a medical model where the emphasis was given to only treating the disease as a whole. But industrial therapy also considers the environmental, sociological, and psychological aspects of the worker. So ability management, placement, and prevention. As we can see in the flow chart, before placement of the worker according to their physical demands and capacities, we first perform a job analysis, then a job description is done, and then we make the job offer, after which job placement and assessment is done. After job placement, the worker is again reassessed and checked. We check for their education and training, which is specifically required for their job. Work conditioning is done in case of any injury or if they need to meet a particular amount of physical demand. And lastly, based on their work, if any job modifications are required, they are made in the end. So, to rehabilitate the worker back to their job, team effort is required, and team effort is required to rehabilitate the worker. So in the team, it includes their co-workers, family, physical therapist, employer, physician, psychologist, occupational therapist, attorney, vocational rehabilitation consultant, and exercise physiologist. So basically, an interdisciplinary coordination is required for rehabilitation, and we not only consider the physical demands of the job but also the functional context of the worker. Aims of job analysis: to provide a safe working condition, return the injured worker to the job, to accommodate people with disabilities, for matching workers' functional capacity with the job, correcting risk exposures, to determine work conditioning and hardening goals, and for designing a modified job to ensure a safer return to work. Job analysis. So, job analysis consists of job demand analysis, task analysis, and ergonomic evaluation. So, the job analysis documents the essential functions of a targeted job or task. A job analysis includes a general description of the identified job tasks and evaluates the physical demands of that particular job. So the reason that we are documenting the physical demands of the job is because we want to prevent work related musculoskeletal disorders which may occur when there is a mismatch between the worker's job demands and the physical capacity of that individual worker. So, job demand analysis. It is an objective and systematic procedure to identify the demands of a particular job. Example, lifting, carrying, pushing, pulling, basic physical demands. Mobility requirements like walking, climbing, sensory and perceptual demands like hearing and vision, environmental conditions like exposure to heat, cold, and vibrations. Task analysis. It measures in more details the individual tasks which are more frequent or potentially high risk, their duration and forces generated. So, for example, when a job demand analysis identifies that lifting of X kilograms into X number of times is potentially a high risk, a task analysis would be performed. So, here we are looking at the frequency of doing those particular tasks, and we are classifying them as more frequent, less frequent, occasional lifting, etc. Here, the height lifted and the distance carried is also measured. So, all the aspects of doing that physically demanding job is measured. So, the weight of the object that is being lifted, the distance for which it is being carried out, and the height from which it is being lifted to. Ergonomic evaluation. So, an ergonomic assessment is done on site. An ergonomic assessment looks at the tasks of the job and the ability of the worker to do job. So, ergonomic evaluations can be qualitative or quantitative. Recommendations are often made that can include equipment modifications or acquisitions, job modifications, proper lifting and ergonomic education, and instructions. So, this is a quantitative form of doing an ergonomic evaluation with the help of the rapid upper limb assessment. Qualitative evaluation can be done with the help of surveys. So, in the rapid upper limb assessment, as we can see, it is divided into various components. First is the arm and wrist analysis. After we do that, then we move on to the step 1, step 2. Step 3 will be to locate the wrist position. And after we finish step 1 to step 8, we move on to the right hand side of the sheet, which is the neck and trunk and leg analysis. After we follow that and do measure that from step 9 to step 15, we come to the middle of the sheet where we can see table A, where we combine the upper arm, lower arm and wrist scores. And then we move on to table C, where we found the cumulative score of wrist and arm score, and then we combine that with the neck, trunk, and leg score. And the final scoring is between 1 to 7. 1 to 2 is acceptable posture, 3 to 4 is further investigation and change may be needed. 5 to 6 is further investigation and change soon, and 7 is investigate and implement change. So then we get the final ruler score. These are my references. Thank you. Lastly, I would like to thank Mrs. Manisha Sanghi ma'am, our chairperson at Sancheti Healthcare Academy. I would also like to thank Dr. Purva Shimpi sir, our principal at Sancheti College of Physiotherapy. And also I would like to thank the technical team at PhysioTV. Thank you.